I don't need to be considering abusing now. These are the watches.
See, I put back. Thank you, go in your book.
Are you taking it? Grab my mask.
No, I'm telling you that in case you are fixed, you need to have a mask. No, me. Oh, no problem.
That's from that time we give some 3,000, sometimes you get a whole.
My name is Von Lizette Nene, and this is the triage of St. Blaise. Here, before any patient comes, before meeting the doctor, the patient must pass through the triage so that we can differentiate them according to their signs and symptoms.
Before now, there was no triage here, but why the invention of this in St. Blaise Catholic Hospital, Big Mancon?
All right, due to the COVID-19 crisis, we had to put the triage here. That was when it started, March 16, 2020. We had to put the triage so that we could differentiate those who had catarrh, cough, or those who had signs and symptoms of COVID-19 from the other patients, so that we avoid infecting those who came without the COVID-19 signs and symptoms.
Mr. Eric, show that woman who's at the watch fan. Let you go.
It's okay. I'm doing something serious.
The carer with the face mask. That's good.
Asa Charlotte B. I'm a medical laboratory technician here in St. Blaise Hospital. As we all know, COVID-19, so the various measures we put in place to prevent the spread of this virus is, firstly, we disinfect our environment before and after every collection, and we put on protective clothing like face mask, the nose mask, and there's also another jacket that you put on before and after collection.
I'm Kiven Venue Kivu. I am the bursar of St. Blaise Hospital, Big Mancon, and I'm in charge of calculating the bills for patients. I also make sure that everything moves on in the OPT department well.
I'm called Clarice Bingon. I'm the general supervisor in St. Blaise Catholic Hospital. As far as COVID-19 is concerned, what we do for prevention is that we maintain social distancing, washing of hands. We do washing of hands. When you get into St. Blaise, you see they have installed the wash hands in all the places, all the entry points. They are washing hands. Then before you get into St. Blaise, before you come into the hospital, you must be putting on your face mask.
I'm called Sister Teresa B. I'm the director of St. Blaise Catholic Hospital, Big Mancon. We don't have enough material to manage this COVID, especially the face mask and shields and the protective garments, which actually health personnel should have to manage some of these patients on arrival. The district has provided a few, but they are not sufficient because they are not, each staff cannot own one. And again, they are meant to be used just once and disposed. And so, if you have 2, 3, 4, 5, and you need to dispose them, then it means you are left with nothing.
I am Sister Louisa Abid, a sister of St. Therese, Sisters of St. Therese of the Child Jesus of Buea, Cameroon. I am the health coordinator of the Archdiocese of Bamenda. I work with so many other collaborators in the fight of COVID-19. It has not been very easy. It has been very challenging because it's so strange to our society. And worse still with the fact that COVID-19 mimics the signs and symptoms of other tropical diseases like malaria. And so the challenge has been enormous. The testing for COVID-19 is done in the northwest region here in Bamenda. The testing is being done here by the district service, but the COVID-19 is not being managed here. The management is done at the regional hospital, Bamenda Regional Hospital. We know that with the advent of COVID-19, a lot of sensitization and a lot of preparation was done with all the Cali Health facilities. Early in March, when the pandemic, the alarm of the pandemic was in the Western world, we were all aware. But everything was being gotten from social media, and we did not really have we did not really have the facts. But thanks to Medicines of Humanity, towards the end of March, precisely around the 25th, we got the sensitization materials, we got some protective materials for our health facilities, and this really helped us to begin sensitization training seminars. And also we got a training curriculum from Mercies of Humanity, which we use in most of these trainings. We had trainings for the healthcare managers. Since our movement also became challenging, we could only get the healthcare managers to come for trainings, and so they went back and they had step-down trainings for their community health workers and also for their staff members. And a lot of communication was done in the different communities using the megaphone and using other traditional environments to pass on the message to the people. Despite that, the alertness was done, but it took some time. The COVID was not yet in Bamenda, and so it is like, it's like that alertness relaxed, and immediately that alertness relapsed, and then COVID appeared into Bamenda. When COVID appeared, it actually affected most of our health facility staff, because at that time people were not fully aware again that COVID had come, and so some of our health personnel were infected in most of the health facilities, both the Catholic, the private, and the government, the public health facilities. But that was just for the early stages of COVID-19. That was early April. But after that, there was reinforcement of preventive measures, and so far workers have been working with a lot of caution. The challenge that is being faced in the most part is the fact that the protective materials, they are scarce and limited. Because of this, sometimes it is difficult to really maintain proper preventive measures. We do our best, the staff do their best, but we will appreciate, because it is also very expensive for the health facility, since we have to do constant disinfection of the health facility every 3 hours, every 4 hours we are disinfecting, constant disinfection of the toilet, constant disinfection of the laundry, the material, the bed sheets and all that. So it is expensive on the health facility, but we have to do that to protect the patients. We also know that one other thing that has happened is the fact that the population drifted from the public health facilities, and they all were flocking to the confessional health facilities, because people had a misconception that they were being given false positive results for COVID-19 in the public health facilities, which was not true. But so this led to most of the population flocking in our confessional health facilities, and this has still been the case. We pray and hope that COVID-19 will come to an end, so that the challenge, so that the difficulty, because it is made worse in Bamenda, because for close to 4 years, Bamenda has been suffering from the Anglophone crisis. And here we are again with another crisis. So I even call it a double crisis for Bamenda. This has increased the suffering of the people. The worst of the scenario is that of the internally displaced persons who are maybe living in just a single room. Maybe there are about 8 of them living in a single room. If any of them happens to be infected, then every other person is infected. And then, now if they have to be quarantined, it becomes more challenging, because how will they feed, how will they carry out other social activities? So this is really a bad situation, and we really pray that the spread should not continue in Bamenda, because we will not be able to manage it.